This video is going to be a part one of an explanation about Pyrrole disorder. So I'm just going to tell you a little bit about this quite common comorbidity of Pyrrole disorder. You can look it up. This I'm taken from a couple of websites, Healthline. There's also information with the Key Clinic, which is based in London, about Pyrrole disorder. So you'll probably see me kind of looking away because I have not too bad a memory, maybe not as good kind of post-kids, but not as good a memory to be able to recite the information without kind of taking some of it from the laptop to give you basically as full an understanding of Pyrrole disorder as possible. So the reason I'm talking about some of the comorbidities of the likes of autism and bipolar, sometimes issues, if people have anxiety or things like schizophrenia, they might have Pyrrole disorder as well. And I really came across this the first time when we were working with a nutritional practitioner, and firstly the Key Clinic had mentioned it, and then we were working with another practitioner who ordered, it's quite a simple urine test to check for Pyrrole disorder. It was like £50–60 in the UK, so we went ahead with that, and actually all of our family tested positive, and it was kind of mild, but it tends to affect some people more than others. Some people would be kind of asymptomatic, but for other people, and there are other tests that you can do that will kind of confirm some of the results and the findings, which would also be an indication that supplementation might be beneficial. And to be honest, the Pyrrole supplementation, which is recommended in Nutrient Power by Dr. Walsh, has made a really big difference this year in our own family for my youngest, who has a diagnosis of ASD1. So this is some information about Pyrrole disorder. So it's a clinical condition that causes dramatic shifts in mood. It sometimes occurs, like I said, with other conditions. So Pyrrole disorder develops when there's too many pyrrole molecules in the body. These can strip your system of essential nutrients that play an important role in mood regulation. So just as a little aside, quite early on, my son, often it seemed like he was quite down and depressed. Like first thing in the morning when he got up, he seemed quite sad, and often during the day he would have quite high, big emotions and kind of like explode at times and find it really difficult to regulate himself. And when we started following the protocol, I've definitely noticed a difference. He's a lot calmer, he's able to focus more and pay more attention, and he's able to engage a lot more with learning, and that's been a huge difference with We Home Educate, and he's been able to engage more with the home education, which is great. So doctors don't know how common Pyrrole disorder is due to lack of diagnosis. So it's something that, from what I understand, isn't recognised within the NHS. They don't do any testing for it. Unfortunately, has to be done privately. If you have symptoms or a history of mood disorders, it might be worth speaking to someone. That might be a private clinic more than likely about Pyrrole disorder. So what is it? A little bit more information. So basically something called hydroxyhemopyrrolin 2,1 HPL is a molecule naturally excreted via urine. So some individuals might excrete pyrroles more than others, which indicates a toxic level of the enzyme in their body. So it was previously called elevated HPL, or there's some other names, MOVE disorder, and it's now known as Pyrrole disorder. So Pyrrole molecules don't serve any important function in the body, but what can happen is an excessive amount can cause nutritional deficiencies, so particularly in zinc and vitamin B6, which is pyridoxine. Hopefully get that right. So this is because the molecules attach themselves to these nutrients and then are excreted in urine before the body has a chance to absorb them properly. So that's why the test is a urine test, to check for pyrroles. We kind of tested between the kind of 10 and 15 range. Some people have their pyrroles much more elevated, and that would come back as part of the test results as well. So some of the common symptoms, this is what's important to know about for Pyrrole disorder, include irritability, severe anxiety, significant changes in mood, short temper, so temper tantrums in younger children, severe depression, short-term memory problems, inability to manage everyday stresses, kind of melodramatic behaviours, and sometimes like a sensitivity to loud noises, lights, or both. Now, some of these symptoms, there can be other things that are contributing or that are causing them, but it's worth kind of looking into Pyrrole disorder, and it's actually quite a cheap test compared to some of the other tests that we'll talk about later in some of these videos, to either rule in or rule out. So while mood changes are perhaps the primary sign of Pyrrole disorder, there are numerous physical symptoms too. So some of this could be delayed puberty, nausea, especially in the morning, stretch marks on the skin, pale skin that doesn't tan easily, joint pain, leaky gut, allergies, premature greying, so white spots on the nails, that can be indicative of zinc deficiency, frequent infections, constipation, diarrhea, IBS, which is irritable bowel syndrome, and a pot belly or significant bloating. I'm not going to cover the next bit, which is on healthline.com, which talks about and discusses more in depth about Pyrrole disorder versus bipolar disorder, if you're interested in that, or if you have somebody in your family or that you're kind of supporting, that you're wanting to look into that, you can find that information on healthline.com. So that's the information about Pyrrole disorder, how to go about the testing, what the symptoms are, and some of the other things that might be kind of evident if somebody has Pyrrole disorder. And then generally with the kind of WASH protocol, the main supplements would be zinc, B6 and P5P. There might be kind of other things that would be beneficial, including antioxidants alongside those supplements. So I'm from a physio background, so I would always recommend, if you can find a practitioner, there are a number of different practitioners in the UK, or, you know, with the wonders of the internet and the world, you can find other practitioners online. Unfortunately, like I said, the NHS doesn't seem to recognise it, and they wouldn't, as far as I'm aware, you can put in the comments if there's any difference, they wouldn't do any testing for it. But from a personal point of view, and you know, with supplementing my youngest, it's definitely made a big difference. And normally if you supplement, and if Pyrroles is one of the kind of leading things that's causing some of the mood differences, you should notice within like 3 or 4 weeks at the most with supplementing an improvement in those symptoms. So feel free to like and subscribe if you're wanting more information to kind of look at some of the things that might be comorbidities, or some of the issues that go alongside the likes of autism, ADHD, OCD, tics, and these kind of not common but more common than they were kind of differences. Thank you.